Are you wondering what are the main speech sound milestones you should expect from a child who's around 4 years old? Maybe your child is just about to turn four, or maybe they're between the ages of 4 and 4.5, and you're wondering which sounds they should have, which ones it's normal for them to say incorrectly. Well, you've come to the right place. My name is Amini. I'm a speech and language pathologist with several years of experience in clinics and in schools, working with parents and children to help boost speech and language development, especially in children under 10. And my mission with this channel is to empower parents and caregivers of children under the age of 5 years old, because this is when a lot of speech and language is developing. And the foundations that you set now, just through little changes in daily routines, can really boost learning foundations and reading foundations in the years to come. So, in terms of speech sounds, I'm going to talk about three main ones that I would look for if there was a 4-year-old in front of me. A quick disclaimer about speech sounds. I get asked this question a lot. Why is it important for a child to have their speech sounds? Anyway, they're going to start saying the sounds at some point. Well, there's a few reasons. First, speech sounds can be the foundation for reading, because if a child isn't able to tell the distinction between one sound and another, then it's going to be hard for them to tell the distinction when they are reading or when they are writing. So we want to make sure our sound system is correct when talking and listening first, because it helps reading and writing. The other reason that we want to focus on speech sounds is if a child is not very clear, it really impacts them when people around them, like their peers or adults, don't understand what they're saying. So we want to make sure that your child has a nice, strong start and that they're not struggling to be heard. So the first milestone that I look for is 100% intelligibility. What does this mean? So intelligibility is how clear a child is, how easy to understand they are. And normally when you say 100% intelligibility, that doesn't mean that all the sounds are correct and there are no errors. At the age of 4, a child's speech sound inventory is still developing. In fact, it's developing all the way until the age of 7 or 8. So some mistakes are completely okay. But at the same time, if there's an unfamiliar listener in the room, so a teacher maybe, or a grandparent or an aunt, if they are in the room with the child, then they should be able to, for the most part, understand what the child is saying. If your child at 4, they're normally saying quite a few sentences and putting sentences together. If these sentences are not easy to understand, that's usually an indication that something is wrong, that you need a little bit of therapy perhaps to fix some sound errors that are impacting speech clarity. So the first one is 100% intelligibility, meaning if you can ask anybody who's not mom and dad to listen to your child, they should be able to understand all of what they're saying, even with a few errors here and there. The second milestone that I look for is how the sounds L, S, and Z sound. So these sounds might not be completely in yet at 4, but they should be emerging at least a little bit. So a child should be saying words with L, S, and Z. If you're not sure how exactly to look out for that, I have some words that I recommend that you keep an eye out for. So for S, you want to look for C or some. For Z, you want to look for plurals like pigs or dogs, or maybe zoo. And for L, normally you want to look for words like or love. Are these words being pronounced at least once in a while? At least once in a while, are you hearing those sounds? Sometimes when you're listening for a particular sound, you might need to listen for a while. So what I suggest is just sitting down with the child, talking to them, and keeping a notepad in hand. So as your child is talking, you can jot down whether or not you hear those words. So for example, if your child says, I like this, then you can already say, oh, I hear an L in there. So you answered that question. You could do the same thing for S and Z. They should be emerging. They don't have to be correct all of the time. Now that we're talking about S and Z, though, I do want to do a little bit of a disclaimer, because S and Z is where you see lisps. So there are two kinds of lisps. One of them is when the tongue comes out of the mouth like this. So instead of saying this, I would say this, this. This can be okay when a child is less than 5 years old, but if it's consistently happening and you really see that tongue jutting out, that is something to mention to a preschool teacher, maybe to the school speech therapist, to a private speech therapist, or to a pediatrician, because there might be something else going on dentally, maybe, or you might want to keep an eye on that. If that S and Z, the tongue poking out, is not going away in 6 months or so, you definitely do want to take some action, speak to a speech therapist, get evaluated. So it definitely raises a flag for me if I see the tongue jutting out on S and Z. I watch it for a bit before making next recommendations. The other type of lisp that you might see is a little bit more complicated. So instead of the tongue sticking out, the sides of the tongue lift to make S and Z. So for example, if I'm saying the word see, it would sound like she, like that. So that is a lateral lisp that is harder to fix. So if you're seeing that, again, same as with the frontal lisp, when the tongue is sticking out, you want to keep an eye out to see if that's getting better as your child is getting closer to 5. If you really feel like it is not getting better, definitely a good idea to call either a speech therapist or to let the teacher know, to mention it to your pediatrician. A lateral lisp takes some time to fix. So the quicker that we notice this and the quicker that we take some action, the better it is. But again, we can wait until the end of 4 to really take that action, as long as we are monitoring. Another thing to note is that with the lateral lisp, sometimes if a child has a little bit of a hearing impairment, you'll see the S and Z error with the lateral lisp, the yeah. So that is something that a speech therapist can work on as well, just because sometimes it can make the speech a little bit clearer to have the S and the Z be placed forward. So if that's something that you're interested in, it's good to be proactive and to work on that earlier than later. So that's our S, Z, and L, the second milestone that I would look for in a 4-year-old's speech sounds. The last thing that I would look for is around the age of 4, a child should be saying some blends or some mixes of sounds together. So the main one that I look for is actually past tense. So sometimes when a child is saying past tense ED, you can see whether or not they're able to blend the end sounds in past tense ED together. So for example, if you are going to use the word smelled, I smelled that, L and D come together for smelled. Is your child able to say smelled, or does it just say smell or smelled? You have to have those two consonants together. So any kind of a past tense ED verb, twirled, brushed, you want to see if you can hear that ED at the end, cleaned, etc. So you can write some of those down if you would like. Just listen for them in daily routines. If your child isn't able to put two consonants kind of mushed together, that is something to keep an eye out for. Again, as your child gets closer to 5, if that continues to be an issue and you're really not seeing any consonant sounds blended together, that is something to mention to a speech therapist. It is something to mention to a teacher or a pediatrician and see if you need to get an evaluation. So with all speech sounds, again, just because a child is saying it wrong now doesn't mean they won't say it right later. But quick action, A, ensures that therapy might take less time. And B, it also really protects your child's self-confidence during a really delicate stage of their development. So I hope that this tip helped you. And if you look in the description box below, you can find some other resources about speech sounds. I have our mailing list that has a monthly tip based on the season or the month on what you can do to help your preschooler speech sounds. There's also a preschool ebook on speech sounds, or I believe it's a 0 to 4 year speech sound ebook. And then there's also a course on preschool speech development if you would like to check that out. That's all in the link below. And please subscribe if you want to see more content. Check out my channel for other speech and language tips, and happy talking.